Good afternoon, friends. I am Dr. Vishwanath. I'm a general physician, a diabetologist, hepatologist. Whatever, I finished my medical jurisprudence and doing my criminology also. I've just shifted to Adyar area of Chennai, where I had been a couple of decades back. And because of my mother's health, it became a necessity to come back here. And I'm starting my career all over again, probably my second innings. I'm really thankful to God and all my patients because they are each doctor's lifeline. And this is more than a noble profession, it's a sacred profession. But unfortunately, we need to live, as we say in our Dharma Shastras, Grihasthasram. We need to have paper money for survival. So it is a balancing act. Uh, I'm now in a position where I'm looking at getting into a position after 37 years of experience in medicine uh, and after my PG and all that, in and around Adyar or even Chennai for that matter, um, for 5 days a week because Saturdays I do some service and I'm also involved in one of the attached to the Union Health Ministry. We have our meetings on that day, and Sundays I prefer to be with my mother. So, this said, uh, when I was, I've been associated with a lot of organizations, corporate, non corporate, right from Coimbatore and subsequently at Chennai also. And most of the places, honestly, I could not adapt in the sense that the expectations were huge, despite the fact that what through me they were earning 4 5 times of what they were paying me. In one of the hospitals, I remember, I was called for a board meeting, and then the HR was asking me, "Sir, your OP crowd is very high. It is nice, but the investigations and admissions are not that much." See, the answer to this query is there in the query itself because it means it's not required. See, for each investigation or whatever we are telling the patient, I've got to first explain to the patient the need for these. And the doctor patient relationship is very, very important. And some of my videos have mentioned this both in English and in the local language, dialect Tamil. So the other thing is, whenever anyone goes into a job, I feel that the job satisfaction has to be there because I can never forget saying that if you enjoy what you are doing, you need not work for a single day in your life. That is a wonderful saying because it becomes a hobby like this thing. And as far as I can recollect, only one person, I can name that person because only if you are belittling, I don't belittle anyone. Thing is, I just could not get along with certain situations. Who had understood me uh, probably much more than anyone else because I myself sometimes find it difficult to understand me. So, is the chairman of Chennai National Hospitals because he saw how I was dealing with patients, and then he said, "Doctor, I think probably in Tamil he said, or நாளைக்கு probably or 8 to 10 patients you can see, isn't it?" I felt really glad because that was the truth. It was not the number of patients which one sees. You have got to examine, get the history. History means he's telling a story. See, we study medicine as a science and practice it as an art. And the meaning of a doctor in Latin means a teacher. It is not only teaching students, UG, PG, whatever, it is also educating the public without frightening them. This has been one of this is my main aim, probably I can say, in life, is to educate the Indian public. Because just some time back, I was speaking with my wife, and then I was telling her, see, day before yesterday, I had a elderly, educated person, diabetic for 12 years, and I was asking him about the history, and I was telling him, how are your other those thing, your thyroid? He said, no, sir, my sugar is fairly under control now. Then he himself said that, sir, my HbA1c 3 months average was high, but I can bring it down. It is 9.2, but it has been higher. I'll bring it down. Then I asked him, sir, how many years have you been a diabetic? He said, 12 years. 12 years. And then, have you not checked up your heart, kidneys, other those things? Then I had to start explaining about diabetes being a problem with the blood vessels, the endothelium, that too without frightening a person, we have got to tell, so that once they understand, then they agree for the investigations, tests, or even admission for that matter. That is where in the doctor-patient relationship you strike a bond, and that bond is built of trust, like in any relationship, be it between husband and wife, parents and children, or whatever. That trust becomes very important. So, and also one of God's gifts for me is I'm a voracious reader and I'm an author. A couple of books I'm writing. One is an autobiography, which I was inspired by this Frank Boehm's book that is Doctors Cry Too. There was a stage in my life when I was really depressed, upset about things. And then several years back, my father told me, see, hey, he asked me to read this. I said, it's good. He said, this book has been the bestseller list for 6 months, international bestsellers list. Don't you think you can write better than this with your experience, everything? Not just about medicine, about how difficult it is, why you had to leave government service and come. So many things, instances, postmortems, this, that, interesting experiences where medicine is like probably what my guru KP Mishra used to say. In the first year, you should be studying medicine, I mean, anatomy, physiology, and Sherlock Holmes. The power of observation is very, very important. And when we get the history, by that time you should have come to the diagnosis, looking at those things. And it is not just the patient's diagnosis and treatment alone, the physical treatment or whatever. We'll have to look at his financial capabilities, look at his mental status, how it is, and all that. That is what makes it very thrilling, medicine as such. I was pushed into medicine. From engineering, I had shift to medicine because, fortunately or unfortunately, at that time I was never interested. My dad had a massive infarct and was in the ICU at Coimbatore in a major hospital where I also worked later on. Then, from I had wanted to do my engineering in the college which he finished his engineering. My father was a PG professor and head of the Department of Mechanical Engineering at Coimbatore Institute of Technology. So I got my this thing at Pilani also and seven other colleges by God's grace. But I joined PhD Tech because I didn't want to join the college where my father was the PG professor. And then finally got pushed into medicine in anatomy, sitting and wondering when I saw those dead bodies for the first time. My God, where have I got into? I can't leave here also now. I can't go back to engineering also. But when I came into clinical medicine, I started loving that subject. And after I finished my MD and all that, I got my cardiology. That was when I told my father, with no disrespect or not belittling any of my super specialist friends, I told him, see, I want see, basically, I studied for your sake because I had to treat you. That was the reason I joined medicine. And I know that it is not ego. I'm as good a cardiologist, neurologist, or whatever. I would not include nephrology at that time because nephrology, oncology was zero for me, still zero. And nephrology at that time was about 50% because at that time I had seen most of the patients were gasping for breath, dialysis. Nowadays it is all changed. Even in cancer, those things, a lot of curative therapies have come. Apart from these, I'm good, but I still have to keep reading because no one can say is an authority in some subject because it's so vast. You read, you learn every day. There's a saying, you listen to learn and learn to listen. First you learn to listen, then you listen. When you're listening, you learn. When I teach, I learn. So you can, those things, no. See, a cobbler, if my shoes go off, I'll have to drag my feet and go to a cobbler. I don't know his work. So everyone is equal in some way or the other. But in this profession, especially for me, the gift is I've started writing a book now, A Doctor's Dilemma, Ponderings of a Physician. And another, and my interest is in wildlife, especially tigers. So the Jim Corbett also, Kenneth Anderson, his sequel to his books, True Life Stories, Rambling with Anderson. That is Man Eaters about 80 years back because they are nearer than Jim Corbett's this thing. I love wildlife. I go off into the forest every 3-4 months for 3 or 4 days and stay there. That gives a lot of peace, serenity, being with the nature. See, it differs with individuals. Uh, and that is my passion. And writing books, singing, listening to music, reading. Still, I cannot sleep if I don't read a few pages of my Kindle. And of course, half an hour updating myself with this thing. And always collars don't go up at all because you know that doctor can only treat, but God heals. Whichever God, there is some power. Let us not get into a discussion about it because it will go into religion. Religions have changed according to their satisfaction needs, the way they look at God. So everything is about spirituality, every religion, love, care, compassion, affection, all these, positive qualities. And one has to eventually become spiritual. But at this age, I am in a situation, I have been doing a lot of service, which I need not tell others, keep it to myself. And I had a heart problem, so as such, I cannot, I have to choose my job options as such at a stretch, probably 5-6 hours, and then some evening practice or something. And Saturdays, Sundays are very important. I'm one of the most important in that group, anonymous group of the union government, which is monitoring the medical field and giving, recommendations for this. But one thing is that I've seen that one of the gifts God has given me is to talk. I remember Robin Cook's thing telling that physician is one who knows everything but does nothing, like me, only talking. A surgeon is one who knows nothing and does everything. And a pathologist is one who knows everything and does everything a bit late at post-mortem. And a psychiatrist is one who knows nothing and does nothing. See, no harm. It was just intended, no pun intended, just on a jocular side. And then often pathologists say that neurologists build castles in the air. A psychotic goes and lives in that, and the psychiatrist collects the rent. So all this patient education is very, very important. And for me, I've given a lot of patient education programs live on television. And several of my friends, top levels, even professors, they were asking, live, it is difficult. See, it is not difficult at all because there was a time when I used to shy away from a group and go, always feeling of inferior. Today, any number of, it doesn't matter, I can talk. because I'm only when I'm telling about a problem like this thing, what the patient needs to know is very important without frightening him, and that education, because he's going to live with these diabetes, hypertension, which are the cause of all the other ailments when you look at it, and these have to be addressed properly. And how they are to be addressed, hypoglycemia, various things you got to when you are explaining without frightening the patient. In the sense that, I can tell an example. Suppose a patient comes with a BP of 220 by 124 or something. At that time, I can't tell him, see, silent killer, the three major complications are tube bursts, pump fails, and filter leaks. Immediately, his BP will shoot up, and one of these will happen, first two. So it is when everything has settled down and then tell. Several patients are told that my BP has been higher than this. Nothing has happened. So that's why you say it's a silent killer. I have taken them and shown them a patient with an intracerebral hemorrhage. Where the patient, 44-year-old person, something like that. Sometimes you have to frighten, and that is very, very important. And that concern has to be there during practice. If people keep coming in, for example, nurse, so I came to see whether BP person. See, the thought contact process gets cut off. What I've been telling the patient, I'll ask him what was I telling. This is very important because for him it is very important. In the video on doctor-patient relationship, I mentioned that because I have been on the other side, it is easier probably for me to understand what a patient or a patient's relative goes through. Years with my father, then my mother, and myself having health issues. But still, thank God, it is with those things. So now looking for an opportunity where to start workshops on the art of medicine, adult vaccination, advertising in any of these institutions. When you advertise about the hospital, those things is different. See, a doctor cannot advertise according to the legal thing. But when I am telling live about any issue for that matter, in Win TV, I have given 24 continuous weeks of 1 hour. Those things for patient education, the TRP or whatever, I came to know only later about that. So that started going up, and then they started asking from the south, people started coming south of Tamil Nadu because I'm just going to talk what I'm going to tell a patient. It is not a viva for me. So it doesn't matter. If you don't know, it doesn't matter because no one knows everything. Somebody says, I know everything is lying. So that is the biggest advertisement, live on television, not showing surgeries. I mean, gaudy pictures of blood and all that, but explaining to the patient small bits about anemia, whatever it is, all these things, commonest cause, worms, whatever. All these patients need to know in the reception. You can have various doctors doing that. So, in building up an institution, I've always been good at building up Department of Medicine, whatever, in various institutions and then leaving because of say various situations, circumstances. Only now I've settled down fully in one place, but this video is going too long. One thing I wanted to explain was where is the primary physician gone? We used to have no this thing. One doctor, Dr. P.K. Kalyan Raman at Coimbatore, and Dr. Sundareswaran, a doctor with whom they were like family members. They knew about us, and we could trust them, talk to them well. And why I'm telling is, nowadays it's not there. If I go with a headache to a neurologist, naturally he'll ask for an MRI because he doesn't know about my lifestyle. So if I know about him and know that it's a tension headache, to convince him, probably I might say, do a screening. Otherwise, you'll not be satisfied. So that is why the family physician, primary physician is very important. Even in a major hospital, in the ICUs where confusions happen, different consultants telling different things. One consultant telling fine, urologist. The next, after a few minutes, another consultant coming and telling cardiologist, no, the patient is bad. This thing is very important, where the uh, ICU consultant has to explain, even if it is my patient. I will tell him, this is what I'm going to tell, and go off and you explain. So these are all very important. Marketing via media is the best, and you're doing service. You're educating the public who don't know, like that patient if for yesterday. Then I had to explain and tell him that all will be fine. It is a disease which affects all organs, and you've got to understand that thyroid goes hand in hand, mainly hypothyroidism. It is again a gland, endocrine gland problem, without frightening, and then making jokes, humor. All these are very important in life. So, as such, I am now wondering, it is all about specialists and like my guru KP Mishra used to say, super specialty is knowing more and more about less and less. He didn't also mean to hurt super specialists, but that is how it is. Because if now, after if I'm practicing for 25 years a particular specialty, naturally I will start forgetting or not updating myself